Hi there, I'm Dr. Hollie Hickman. I'm a plastic surgeon at Ponte Vedra Plastic Surgery, and I'm here today to talk to you about breast surgery. So let's start off with breast augmentation. So breast augmentation is straightforward. You come in, have a consultation with your provider, and then we have a 3D imaging where we can actually take pictures of you and show you what you would look like in your different size implants based on what your preference is, whether or not you want to look natural or whether you want to look augmented, and then you go through implant selection. The Chrysalix imaging is really fun because you can kind of see real time what you would look like with the sizes that you like. And it varies with everybody whether or not you need just a breast aug or you may need a lift also. There's also the decision of over the muscle, under the muscle, whether or not where your incision is, whether you have it under the breast, around the areola, or through the underarm. So there's a lot of things you walk through during that process with deciding on a breast augmentation, and your provider goes through that with you in detail. Then you come back for a follow-up if it's something you decide to do, and then you have a pre-op visit where the surgical nurse goes over your before care and your after care, and then you talk with the surgeon again. If you know you want to have a breast augmentation, coming into the appointment, have looked at some pictures. There's some great websites like realself.com you can get on and have some ideas so you can tell the surgeon, you know, this is what I'm thinking, what size is this for me? That also helps facilitate kind of that communication with your provider. If you come in and you need a lift, some people just need lifts and some people need a lift with an implant depending on how deflated you are. And again, that's a personalized discussion with the provider. So if you need an implant, then you go through the sizing process as well. Chrysalix imaging doesn't work as well when you have breastosis. That's the medical word for SAG, because it doesn't really know what to do with that extra skin. 3 different types of lifts. There's the peri-areolar if you don't have a lot of sag, which just is an incision around your areola. There's the lollipop or the vertical mastopexy, which is an incision around your areola and down. And then there's the wise pattern. If you have the most amount of ptosis, meaning breast sag, then you get an incision around your areola, down and under. And that's all determined by your measurements, and then of course with the provider and how healthy your skin envelope is, if it's tight or if you've had a lot of kids and it's deflated. And then you move on to a breast reduction. And a breast reduction is always a wise pattern if it's a big reduction, which the wise pattern is that anchor that I just mentioned around the areola, down and under. And then the reduction just depends on what you want to be. If you want to go down to a C cup or a B cup, that's a discussion with your provider as well. You can bring pictures in when you come in to kind of give them an idea of what you're thinking to see if those expectations are realistic. And then probably one of the more common surgeries right now is implant removal. A lot of women come in, they've had larger implants placed when they were younger, and then they've gained weight, now their breasts are humongous, and they come in wanting to get a smaller implant and a lift. And what they don't realize is that at that point, because they've got so much breast tissue because of the weight gain or just the breast enlargement over the years, they can actually get that implant out and they don't even need it. And I'm actually surprised at how many people are surprised that they don't need an implant at that point. So you can take that implant out, you do the lift, and they've got this perky little chest wall breast, and they love it. And patients don't have to worry anymore about having an implant or the complications that come with having an implant. I always tell people, if you don't need an implant, you don't want one. So I hope that helps. I hope that educated everybody. For information, visit our website, www.pvps.com.